Hi, it's Abby Bonnell. Joining me on Feedback is Kate Nederostic, who's Program Manager, and Christy Russell, Dementia Specialist with the Utah Department of Health and Human Services. Thanks so much, ladies, for joining me on iHeartRadio in Salt Lake City today.
Thank you so much for having us.
Great to be here.
Caregivers, where do we begin with this? It's such an important topic. They are the unsung heroes. Nearly 1 in 5 adults are caregivers in Utah, providing regular care or helping out a family member, partner or friend with health problems, maybe a disability. It's a tremendous responsibility, isn't it, Kate?
It is. They do take on a lot of tasks supporting another person. 80% are managing household tasks such as cleaning, cooking, and then another 50% are assisting with personal tasks such as bathing, dressing, grooming.
And not just that, it's all the financial side too, and all of the caretaking. You think of our busy lives. I mean, it's almost a full-time job. I know for me, that's how I spend my weekends, catching up with all the stuff I don't do when I'm at work. But just imagine you're having to care for somebody around the clock in many cases as well, especially, Christy, if they have dementia.
Yeah, that's correct. So we have about 34,000 people in Utah living with Alzheimer's disease. We don't have statistics for the other dementias, but imagine all of the caregivers that they require. And that's not just the tasks that Kate mentioned. That's also making sure that they're safe within their home. They're not doing something that could hurt themselves because they don't have, depending on the stage of the dementia, they don't have that brain space to know that could hurt you. Don't wander here. Don't go there. They need someone physically watching out for them throughout most of the day.
That's a huge responsibility, isn't it, if it's your loved one that you're having to care for, because you really feel that you're going to be on duty at all times if dementia has gone into the advanced stages.
Exactly. And in Utah, most of our caregivers are actually what we call sandwich generation. So they're caring for their own children and they're caring for like a mother, father, in-law, someone like that at the same time who may have dementia.
I have a friend right now who's stepped in to take really charge of a brand new baby and now is seeking custody of that child and also has elderly parents. That's a perfect example of a sandwich boomer, really. And they're trying to continue with their employment too. It really does, doesn't it, Kate, impact employment opportunities? It has to. You must be exhausted at work.
Yeah, 60% of caregivers are working, and I would say the majority of those individuals have experienced an issue at work. Maybe they've had to pass on a promotion. They go into work late. They've had to take time off because of their caregiving responsibilities outside of work. So it's been a challenge for sure.
And also financially, if you're a boomer, you're thinking now about your own retirement, trying to really kind of accumulate that 401k, but suddenly that's getting depleted too. What advice do you have for them, Christy?
There's a lot of government resources that focus on the caregiver. So not the person receiving care, but the actual caregiver themselves. Unfortunately, in Utah, it's not like you receive a paycheck or something like that, but there are things called the Area Agencies on Aging, and they can connect you with services. One of them being respite care, which is essentially, we call it a caregiver break. They can either come into your home or you can take your loved one you're caring for to a community for the day so that you can have that day to kind of catch up on things that you need to do. And that's really helpful with mental health as well.
So, Christy, somebody listening right now who thinks, oh, that's me. I just need a bit of space for myself. Who wouldn't? We all need that. Right. Or I need to book a doctor's appointment. How do they go about doing that, Christy?
So Utah has 12 area agencies on aging. And you can find them via the Elder Care Locator, which is eldercare.acl.gov. And that's a nationwide website. You just put in your zip code and it'll pop up the one you're looking for. Or you can go to your public health departments, things like that. And there are social workers, case managers there that will actually sit down with you and chat about what you might qualify for, what you need, and see if they can help you with any services.
What about support groups as well, Kate? I'm sure they're absolutely integral in all of this.
That's one of the services that the Area Agencies on Aging will provide. In addition, there are a number of nonprofits throughout the state that offer support groups as well. What's great about those types of meetings is it allows caregivers to come together and connect with one another, learn from each other, but also having that ability to share your story with others who know what it's like, who know the challenges that you're going through, They know the struggles, they know the stresses. So to have that validation is very important.
Really, when you think about it, family caregivers are the backbone of our healthcare system. We couldn't manage, could we, really, without them? And most of them, Christy, are unpaid.
Correct. Yeah. A majority of our caregivers are totally unpaid. In Utah, if you qualify for Medicaid and you are a spouse of someone with dementia, there's a possibility you could get paid. But again, Medicaid is hard to qualify for. And so our unpaid caregivers really are what's holding our medical system up. The cost of Medicare annually is
A tremendous
a
amount.
tremendous amount.
Yes,
I think it's something like $24,000 a year just for dementia.
Well, I saw a figure, $600 billion in unpaid work, according to a new survey. I think that was from AARP in 2023 in the US, for people who are really stepping up and doing all of this caregiving. If they were in a paid environment, that's how much it would cost us. I mean, the system would be absolutely crippled. Again, they are the unsung heroes.
Right. And a lot of caregivers don't see themselves as such. If I say, hey, are you a caregiver? And you say, well, no, but I help my friend or my neighbor or my parent with cleaning their house, mowing their yard, helping them with their medications. That's just what you do as a loved one to that person. But in reality, they are caregivers. And so it's hard to get caregivers to see themselves as a caregiver. So they don't always seek out the resources because they think, oh, that's not me, that's somebody else.
We need to make people aware of those programs because a lot of us have no idea what's available to us. And it's so important because each case is so challenging in its own way, but there are people there to help.
Correct. Absolutely. And if we can help connect you to those services, even if you're not sure you need them yet, start exploring that now. The sooner you get connected to these services, you don't get into a crisis mode where you feel like you can't continue doing your caregiving duties. We want to help you before you get there.
Kate, I've heard that in the next 2 years, 1 in 7 Utahns are going to be looking after somebody. They didn't have any clue. Things happen. And suddenly you're put in a brand new environment. Now's the time to prepare. Don't just wait for it to happen. Is that the case, Kate? And what can they do? What should they be thinking about right now?
Exactly. Utah is such a family-oriented state, which is amazing. We absolutely step up and help friends and family members when they need support. And that's great to have that. But it's not innate to know how to support someone, in, for example, with dementia or with cancer or a mental health or a disability. And so to connect with resources in the community, that will help you to plan for what's going to come down the road. There might be legal planning you need to think about. There might be some financial issues to think about. You might need to gather a group of people around you so that you're not the only person supporting this other individual. So the more people that can help and can work together, the more support that individual, that care receiver receives. And it's not just one person managing everything. And then it's less overwhelming.
You know, it can take a tremendous toll on the caregiver's health. And they don't realize it. I mean, they're trying to do everything. They're being Superman or Superwoman here on their own. If it's a problem, we just get on and take care of it, don't we? Unless they have that support system, things can go horribly wrong. Their health then, Christy, can also suffer as well.
Yeah, absolutely. We're not just talking mental health as in stress. We're talking physical health as well. Caregivers stop thinking about their own doctor's appointments, maybe their own chronic conditions. They're not necessarily paying attention to themselves because they're spending all of their time on their caregiving duties. And a kind of scary statistic is spousal caregivers of somebody with dementia, they about 20% of the time pass away before the person they're caring for.
Which is frightening.
Yeah.
Setting up a care team is critical. Explain why, Christy.
Setting up a care team allows you to kind of separate those duties. So maybe one person's doing financial, one person's doing doctor's appointments, one person is okay doing the bathing and the dressing and things like that. So you've got that separated and you can all work together to do that caregiving versus all of it landing onto one person. You can also work together to give each other a break when you need that break.
Perfect. And can someone be paid, Kate, to be a caregiver in Utah?
There are a few opportunities for someone to be paid, but as Christy mentioned, they really need to qualify for those specific programs. There might be a Medicaid waiver they might qualify for. So at this point, there really isn't across the board an opportunity. We do have, I would say, there are federal tax credits for folks who are caregivers, not state tax credits. But there is that as folks this time of year are working on their taxes, just keep that in mind. They can look for those federal tax credits. But there's really not a lot of opportunity for folks to be paid right now, which is, again, all the more reason why it should not fall on one primary caregiver. The more people that pitch in and help, the less work it is.
This is a pretty startling statistic here. Dementia rates, we all know, they're rising sharply. 1 in 10 people in Utah are caring for a person with a cognitive health issue right now. It presents a totally different set of challenges. We have a lot of people who are in that situation. And again, if they're just joining feedback right now, there are lots of resources through the state of Utah that can step in and help and support.
Absolutely. And the easiest one, the one that we refer everyone to as your first point of contact, is your local area agency on aging. And the purpose is when they're close, the area agency on aging is in your area. So they know the support groups, they know what programs are available, they know where to direct you. They are the expert on this in your area, and it's totally free for you to visit them.
Not everyone can afford an assisted living or nursing home. Some people have no desire to leave their home. What resources are going to be available to them? I take my own father. The thought of him ever leaving the home that he was born in was absolutely out of the question. There are things we can do to make it easier for that caretaker with adapting equipment and such like.
Yeah, the good news is there are resources and support that can be brought into the home to allow that individual to stay at home as long as they would like to. Organizations like personal care agencies that can come in, provide social visits to provide some respite for that caregiver, on up to light housekeeping, meal preparation, even help with those activities of daily living, those bathing and dressing and grooming type tasks. Then you've got organizations like Home Health and Hospice that can come in as well. But then you have organizations like the Area Agencies on Aging who provide services, chore services, where they'll come and help shovel the driveway in when it snows or mow the lawn. Or they'll bring a lunchtime meal from their Meals on Wheels program. So those services are available as well. One of the best things to do is to connect with that Area Agency on Aging and have what we call a care consultation, where you'll sit down with a professional. They'll identify your needs and then connect you to resources in the community.
Do you know, I think it's really important for any caregiver or, looking after someone right now that they actually feel comfortable in doing that, because a lot of people are shy in coming forward. They think, oh no, my case isn't that bad.
Yeah, everyone's case is different and everyone deserves resources. Find it now. They can help you find things that will help you in the moment and help you plan for the future.
Okay, Kate, your best advice right now to everybody who's listening, what would you like to leave them? What kind of note and advice can you give?
The work that you're doing is paramount. It's crucial to the person that you're supporting. What's important to continue to do that and be the best caregiver you are is to make sure that you're getting the resources and support that you need so that you can be that amazing caregiver to that other person. Your health is going to be paramount.
Christy, your final thoughts.
My final thoughts is just connect with your area agency on aging. And if you feel like you can't continue the caregiving journey, there are resources out there. There's nothing wrong with these assisted living communities or memory care communities. As someone who has a family member living in one currently, sometimes your family just can't do that hands-on care, and that's okay. That's not a failure.
Well, my thanks to Kate and Christy from the Utah Department of Health and Human Services for sharing such valuable information. Visit daas.utah.gov or call 1-877-4-AGING-0. Thanks for listening to Feedback on iHeartRadio. We'll see you next time.